Uh, Somali Health Board is a grassroots organization organized around reducing health disparities for East African, Somali and other East African refugees and immigrants in Western Washington, especially King County. I also proudly serve on our state's Universal Healthcare Commission. And today, actually, it's an honor for me to be here with my great friends of like-minded leaders of healthcare is a human right. Our state's, healthcare is a human right. Our state's largest community labor coalition fighting for universal healthcare for everyone in Washington and the nation. I was told by a little bird if we keep up the chance, we might get what we want today. So let's keep the energy up. So this is gonna be our first chance. Everybody in, nobody out. Everybody in, nobody out. I want to hear that from you all, good people, and give it a little push.
Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out.
Thank you. That feels really good. So today, our hard-won programs and democratic values are under attack by an authoritarian coup and the looming threat of fascism. I think you all know what I'm talking about here. My great friend David is reminding me to keep the mic close to my mouth. So it's easy to forget that we're the only industrial country that does not guarantee health care to all its people. Such a shame, right? Even here in Washington State, where we have greatly expanded access, these gains are now being threatened by the budget deficit. It's a thing, it's real. The budget deficit is there, but it should not. So I'll get to that part. Now, we applaud the House and the Senate for proposing budgets that raise significant revenue and include wealth tax. Let me rephrase that part. We applaud the House and the Senate for proposing budgets that raise significant revenue and include wealth tax. Now, I recognize a guy looks like me with an accent saying, talking about money and raising, that kind of has its own connotations, but there are details that's being worked out. But the message here is clear to our elected officials and to our Governor Ferguson. We demand raise progressive revenue, do not cut essential services or balance the budget on the backs of the workers and the most vulnerable.
1 minute.
Washington voters have spoken in the election as they have spoken to elect you, Mr. Governor, to uphold the capital gains tax, confirming the wealthy must pay their fair share.
That's right.
It's only fair that they pay their fair share. We're not saying we're going to take everything. We say just pay your fair share. We have a great list of speakers today, and I will introduce them as they come on. But I would love you guys to keep up the energy. Please be supportive and as much noise as you can make so that they can hear us back there. Let's do one more round of chant here. Everybody in,
Nobody out.
everybody in,
Nobody out.
everybody in, nobody out, everybody in,
Nobody out.
and that's what healthcare is all about.
All right.
Awesome. It's my pleasure to introduce our first speaker, Insurance Commissioner Patty Kuderer. Before taking her new role, I would like to get some more applause for this. Thank you. So, before taking on her new role, Patty served as a state senator and has been a staunch ally in our fight for universal health care and real cost controls. Patty, please welcome.
Thank you so much. Okay. Okay, you know, I'm just going to start with a note of gratitude that you all decided to show up here today. Because when you come down here and raise your voices, people in there listen. So I want to start with a thank you. And I don't have to tell any of you that our tax structure is broken, right? We all know that. And we also know that we need progressive revenue. That is long overdue. And I don't know if you remember I used to be in the legislature, and I don't know if you remember, but I had a little bill that would have helped out property owners by eliminating something called the uniformity clause that's in our Constitution, right? So the uniformity clause says that the modest bungalow in my district in Bellevue pays the exact same tax rate as the Amazon Sphere building downtown Seattle. Now, does anybody think that's fair? Anybody? Yeah, that's exactly right. It is not fair. The uniformity clause is a relic from 1889. That's how long ago that was put in our Constitution. And it's time that we just torpedo that, get rid of it so we can have progressive revenue in the state of Washington. Because we do need the rich to pay their fair share and for us to modernize our tax structure. Because people are struggling and they do need relief. And they expect their government to be there for them when they need help, right? That's what government is for. Government is in the business, if you want to run it like a business, but it's in the business of serving the people. And every day we see attacks and undermining the very services that people in our state rely on, right? And that includes attacks on the ACA. Now, I just want you to know at the Office of the Insurance Commissioner, this ain't the first rodeo with the Trump administration. So we've had folks who already developed a playbook, so to speak, to deal with these attacks on our healthcare system. And guess what we did when I was in the legislature? We codified almost every aspect of the ACA into state law. And as your insurance commissioner, it's my job to make sure that those laws are followed by the health carriers in the state. And you can take that to the bank. But that's not all. Just yesterday, this incredibly incompetent Trump administration closed our regional office of health and human services, right? Region 10. That's exactly shameful. And that serves Washington, Oregon, Idaho, and Alaska. And we've made tremendous progress, and our people depend on us, their elected officials, to stand by them. And we'll do whatever we can at the OIC to fight back against, the only word I can think of right now is the useless administration and unrelenting attacks on our people and the services that they deserve and need. And so we are going to be standing shoulder to shoulder with you as we fight back against what we're seeing coming out of DC. And now, more than ever, when every institution we see is essentially on the chopping block, we need to stand strong. And we need to stand strong together. Because together, we're going to get through this. We ain't going around it. No. There's no getting out of this one. He's there. And he's going to be there until we vote in a different Congress in 2 years, and he's going to be there when we vote him out in, well, I have to say that because he's already talking about a third term. Yeah, well, when the rules apply to thee and not to me, I think that should be a lesson to everybody, right? Okay, well, we're not going to be running away from science in the state of Washington. We're going to be standing behind those who work day in and day out in public health and make sure that we're safe here in Washington State. And we are going to do everything we can at the Office of the Insurance Commissioner to help us move toward a future where there is health care for all. I'm going to leave you with this. We believe that, the Universal Health Care Commission that I voted for, and that we intentionally put the insurance commissioner on, we believe that that is there for a reason. It's not lip service. It's not a feel-good bill. It is a commission that has purpose, and the purpose is to move us toward universal health care because health care is a human right. Thank you all for showing up.
I don't think that's enough applause for thank you very much. Thank you very much. Please make sure you sign on the clipboards that the volunteers have so that we can stay connected and continue this fight. So up next, give me 1 second. It might rain a little bit, but we will be here. Trust me. So I'm gonna invite Edna Cortez, a registered for Edna, please. Come on. Thank you. So Edna is a registered nurse and the chair of the Washington State Nurses Association's Labor Executive Council. Working at Seattle Children, Edna has long been champion for universal health care. Please let's welcome Edna.
Thank you, everyone. Can you hear me? I was told by David to use the mic, so awesome. Thank you so much. It is my honor and my privilege to be standing amongst all of you because we are here for a purpose that is so well deserved. Health care for everyone. Everyone deserves health care.
Yes.
I can't hear you. Everyone deserves health care. So thank you so much for that introduction. So I am with the Washington State Nurses Association, and as you know, I have been a nurse for over 35 years. So I have seen, especially as a person of color, I have seen the changes, whether they be good, and unfortunately, whether they are unfortunately bad, which that is what's happening right now. So as a nurse, again, how do we have inadequate access to health care, and that impacts the health and well-being, not just for our patients, but for ourselves and for the families and the patients, their families and their caregivers. You know, and I see it with my parents. It is not just the patients that we take care of. It is a holistic thing. It is not just the patients. It is the families, and it is the patients spiritually, emotionally, and mentally as well. So I want to give you an example of one of the things. So like I said before, I'm a nurse at Seattle Children's, and unfortunately in February we had to cut, the hospital's decision was to cut the funding, especially with Medicaid, for our transgender kids. That is so sad, and I'll give you a prime example, which I was working that week when Children's Hospital unfortunately had to make the decision to start cutting down, especially our kiddos 19 years old and less. They had to cut it down within that week. I was talking to one of the nurses who had to make the sad phone call to one of our parents who was driving from Eastern Washington on the way here to have her child have surgery to have, unfortunately, be canceled. So, healthcare for everyone. Yes, exactly, healthcare for everyone. What we're hearing and seeing happening at the federal level is such a shame, because we all deserve, whether we're 0 months, whether we're 90 years old, we all deserve health care. And we should be able to access it. How can we even possibly consider cutting Medicaid by $880 billion? Not only will millions of people who rely on Medicaid, as my kids at the hospital, they rely on it. And it's not just the transgender kids, it is also all the kids that, all the other clinics, the diabetes clinics, the cardiac clinics, all the other entities that the hospital serves with Medicaid. This makes my heart sad, because these are my kids, these are your kids, this is the community we serve at the state level here in Olympia. We are all facing potential cuts and impacts that would negatively impact the people of our state. We must get serious about fixing our the stupid upside down issues once and for all. Working people, that is all of us, working people, not those billionaires that can afford health care with just a little checkbook. It is us. Yes, that is right. Exactly. So we need a future where everyone has equitable access to quality care. We stand with all of you in this fight for access, universal health care for everyone, especially now given what we are facing with our own federal government. Unfortunately, during this year's legislative session, WSNA tried to help bring back the Keep Our Care Act, or mergers and acquisitions in healthcare. Sadly, unfortunately, that bill died. I know. I can't hear you. If I can't hear you, they can't hear you. What is it? Shame on them, because I'm sure they have health care. I'm sure they have health care without any issues. So, during this year, we've seen too many times how these big hospital systems eat up the smaller ones, raise prices and reduce staffing, and ultimately access to safe and reliable care. Like I was saying earlier, my kids need health care, especially at the hospital. I don't want my fellow coworkers to be calling families saying, hey, unfortunately, you know what, we're going to have to stop this surgery today, so you're going to need to go home and figure this out, or wait a year or a couple years or months. We cannot wait.
Correct.
Our kids need health care now. So we at WSNA and everyone here today will continue to work to hold these hospitals accountable, to put patients first. Patients before profits. I think that's what everybody is forgetting. Everyone is forgetting. It is patients before profits. So put our staffing, everything is cyclic. Everything is cyclic. So patients before profits. We need safe staffing that goes along with that. So everyone deserves access to safe and affordable, reliable, and equitable access to health care. And we're here to hold Olympia accountable to making sure that health care for everyone is affordable. Thank you, everyone. Again, I am humbled by all of you. I am so humbled. Thank you again.
Thank you very much, Edna. Please, one more round of applause for Edna. I'm gonna go off script a little bit here. If you can, please kindly say after. Do the chant one more time. Everybody in, nobody out. That's what helps.
Nobody out. Everybody in. Nobody out. Everybody in. Nobody out.
That's beautiful. Thank you. That's even better than I wanted to do. Okay. So next, I would like to invite Brynn Freal from WashingtonCAN. I like. Thank you. I'll need a lot more than that for her. But give me a minute. This thing is moving. So Brynn has been a strong advocate who have worked to move healthcare legislation. Brynn will share her experience as a patient and the urgency of preventing cuts and making universal healthcare a reality. Let's give one more a welcoming round of applause to Brynn.
Hello, friends. How are we today?
Angry.
Angry. Good. My name is Brynn Freal. I'm a disabled woman, a mother, and a small business owner in Skagit County. I'm a leadership council member of Washington Community Action Network, and I've worked to move healthcare legislation forward in Washington for the last few years. My business helps design interiors for those with disabilities and people looking to age into their homes. I see the crisis of the declination in our healthcare system in my life and work daily. I am here to stand with patients and workers to call for single-payer health care and oppose catastrophic budget cuts. I've suffered multiple rare, chronic, progressive diseases for 31 years. We lovingly refer to my rap sheet of medical conditions as alphabet soup. There isn't a system in my body unaffected by disease and limitations, and it took 18 years of doctors, labs, surgeries, scans, procedures to get a diagnosis and start effective treatment. The personal cost was great. Attaining that diagnosis culminated in a medical bankruptcy. Before the age of 21, I'd maxed 2 lifetime limits on commercial insurance. I was completely uninsurable until the ACA, and without the ACA, I would not be standing here today. But the ACA did not protect me when I was denied treatment at a religious hospital. Nor did it prevent consolidation that's decreased and outright dismantled healthcare for women and children and driven up costs across our state. Insurance companies and affiliates are buying clinics and closing them to the most vulnerable. This is untenable. Say it with me. This is untenable. After Providence merged with Swedish and during a global pandemic, Providence closed women's and pediatrics at one of Everett's hospitals because it was not profitable. This led to an influx of patients at Seattle Children's Hospital. Our child had dual limb orthopedic surgery there in January of 2023. The hospital was so full there was no room for her to recover overnight. There was no bed. They moved us to an infusion room in a recliner. They sent us home at midnight, nerve catheters still in her legs. I was instructed to remove those in my own living room. We are currently on a 2-year wait list for a specialist. For a child. This is untenable! I've seen prescription drug prices soar. I need a biologic to slow the disease progression. That drug was approved for use in 1998. Pfizer bought the international prescription rights in 2009. Primary patent was set to end, allowing biosimilars on the market in 2010. Other nations have a dozen biosimilars in use today. Our representatives allowed the patents to be extended beyond the original scope, continuing to drain our pockets. When Wyeth was acquired by Pfizer, the drug cost per dose was $700 cash. It's 1 dose per week. That was $2,800 a month, $33,600 a year 15 years ago. No change to the medication has been made, and it now clocks in at $4,300 a dose, or over $200,000 a year. This is untenable. Currently, Medicare Advantage, Apple Health Plans, and other insurance companies and providers in our state are not reimbursing medical facilities or providers at reasonable rates. It's causing more system collapse, and this is untenable. Healthcare cannot remain for profit and serve the people.
That's right. That's right.
Amen.
That's right, sister.
Healthcare is fraying at the seams.
Right.
Yes.
The status quo only serves to line the pockets of the already rich.
Right.
With the federal chaos and uncertainty, as a community, we must stand with patients. We must stand with providers. We must stand with public workers to present catastrophic cuts to our care today, and in the long run, challenge powerful interests blocking healthcare progress, because it cannot be.
That's right.
Untenable. Thank you.
Yes, sister.
Thank you very much, Brynn. Before the next speaker, I just wanted to remind everyone why I usually say, we all need healthcare, especially when we're sick and when we cannot care for ourselves. And that happens to everybody, including the governor and the legislators. So if we put a universal healthcare that works for everybody right now, it will work for each of us when we need it the most. I just wanted to also add, I have a full-time job. Half of my check goes to cover my 6 family members because it's so important. But I've been doing that since, I don't know, for 4 years now. There's no end in sight, and I know everybody feels the same about this. This really is untenable. Our next speaker, I would actually like to welcome. I have an intro, but I'm gonna go off script. Vicki Lowe, Executive Director of the American Indian Health Commission, and okay, so Vicki is actually my chair. So she's the chair of the Universal Healthcare Commission, which she actually does so well leading that commission, making sure everybody's voice is heard and nothing is overlooked while we work on getting universal healthcare for the state of for the Washingtonians. Please give Vicki a very well-deserved round of applause.
This is the first time we're meeting in person because we only meet on Zoom. The Aisquatchie, Vicki Lowe Sensna, Statithlam Nusklayam Sensna, Nukslak. My name is Vicki Lowe. I am Jamestown Sklallam and Bella Coola First Nations from up in Canada. I'm the Executive Director of the American Indian Health Commission, among other things. And, the Indian healthcare delivery system is a universal healthcare system, but it's not working either. We all reside on the lands of Indigenous people wherever we live. That land was not given, it was taken. Taken with many promises, including the promise of healthcare. Those broken promises, including healthcare never being fully funded by the federal government, but are trust responsibilities. So for Indigenous people, healthcare is not just a human right, it is also a treaty right. Through self-determination, despite the lack of help from the federal government, the tribes and urban Indian health programs here in Washington State and across the United States have worked to improve the health care of their people. This has required making the Medicaid program work for our clinics and our people. Unfortunately, when funds are tight, we know we will be the first to see the cuts. In this last week, yes, boo. In this last week, tribes and urban programs have begun receiving their first notifications of contracts being stopped without any legal reason. These cuts are coming from the federal government and being passed through the state government. Federal and state programs are critical to the operations of our clinics. Many do not have the kind of reserves that can let us carry out our care without the funding flowing to us. We've done so much work to make our healthcare systems work despite being let down by the federal government every year when they refuse to fully fund healthcare. Between COVID and opioids and fentanyl, we're moving backwards in our life expectancy. This is the worst time for us to have these cuts. Cutting programs for vulnerable people does not save money. It ends up costing more money, and it costs lives. We ask that our legislators think about the impacts of their decisions on our most vulnerable people. Please make sure you aren't taking from those with the least resources to satisfy those with the most resources. Healthcare is a human right. For us, it is a treaty right. Hands off our treaty right.
Thank you. Thank you very much. Thank you. Can everybody hear me? Thank you. So we're gonna need this. We're gonna keep this energy up. I'm gonna invite Carey Wallace, a registered nurse working. Yes. Thank you. You guys have an awesome mom. It's a registered nurse working with the Healthcare Authority and board chair of Howe, Washington. Carey, am I saying it right? Carey is an inspiring leader in our movement. Carey, please take it away.
Thank you. Former candidate for Washington's 3rd Congressional District once said to me, "Healthcare tied to employment is the boot on the neck of the working class." That's right. This image has stuck with me. Health insurance is just one way that big corporations exploit workers while extracting record profits. They dangle health insurance as some kind of benefit that we can't get unless we work for them. I ask you, is it a benefit if you're forced to stay in a job indefinitely without a dignified retirement for health care? No. Is it a benefit if you're forced to stay in an abusive marriage for health care? No. Is it a benefit if you're forced to navigate an insurance coverage upon every illness, every diagnosis, every surgery, every emergency or birth, or potentially face bankruptcy? No! Is it a benefit? I missed one. Is it a benefit if unions are forced to settle for one shitty contract after another for health care? No! Thank you. Is it a benefit if we're forced to work while we have end-stage diseases like cancer? No! Where the other option becomes losing our insurance that we've paid into our entire working lives that just isn't there when we need it the most. No, obviously not, right? No. Washington can change this. We can change this. Those of us standing here today, those who represent us in Olympia can change this. Yes! The Washington Health Trust will finally decouple healthcare from employment. The Washington Health Trust will cover every resident of Washington and still save billions of dollars annually. So far, these savings are not being recognized by our legislature. Despite our volunteers' efforts garnering a record number of co-sponsors in the Senate on Senate Bill 5233 and Washington Health Trust's first ever companion bill in the House, House Bill 1445, entered with 17 co-sponsors, we have not been granted a hearing in either chamber. We do not take this disappointment lightly. We are here today to demand that Senate Joint Memorial 8004 regarding universal health care is passed this year. To signal to our federal government that Washington is ready to take on the insurance companies and put patients over profits. We are here today to demand that the Health Trust is granted a joint work session before the next legislative session so that Washingtonians can discuss the savings and the benefits in a public forum. We are here today to demand the Washington Health Trust is finally granted the hearing it deserves in 2026. Sorry. No worries. We are here today because we have witnessed the last 7 years in a row inaction by our legislature regarding the Washington Health Trust. We ask all of you to get on wholewashington.org and sign the pledge to sign our next initiative. Yes. We will enact the Washington Health Trust by bill or by ballot. Thank you.
Thank you very much. Okay, we're almost there. Please keep up the energy. Next, I would like to welcome Kim Pollard from WashingtonCAN. I would like to take a moment to thank Kim and our friend Brynn. They made the journey all the way from Anacortes to be with us today. Yeah. So Kim is a patient deeply opposed to the healthcare cuts, and please give it one more time for Kim.
Hello, friends. Can y'all hear me? All right. Just want to, well, thank you, wherever you are. And thank you to all the beautiful souls that made it here today, no matter how far you traveled. It is so appreciated. Your presence is powerful. We appreciate you, my dear, and loved your speech. My name is Kim Pollard, as you now know. I am a small business owner and a member of WashingtonCAN. I rely on Apple Health, along with nearly 2 million of our neighbors and friends across the state. I moved from Los Angeles to Anacortes in April of 2024. I still have not found a primary care doctor in my area that accepts my Apple Health coverage. This vital program needs greater investment, not cuts. Until we have a truly universal healthcare system, subpar care with high prices will continue to plague patients and taxpayers. I waited 7 months for an appointment with a primary care physician, and the appointment was scheduled for January of 2025. But in early January, I received a notification informing me this appointment was canceled. The doctor no longer accepts my coverage. I was told this happened because my plan paid so little in reimbursement for claims in 2024. Starting over with finding another doctor willing to take on new patients will be at least another 6-month wait. I have come up against a ghost network for dentistry as well. The networks are already so narrow, I haven't been able to establish any care in nearly a year. And when visiting family in California, I was desperate to refill a prescription of meds, and a previous doctor wrote the script. Of course, I paid full price out of pocket. This is the reality people are living with every day in this entire country. Yes, ma'am. With draconian federal budget cuts on the way, Washington State must be independent of the whims of the other Washington. We cannot burden the most vulnerable among us further when they need our protection most. I implore our elected officials at all levels and branches of government, especially Governor Ferguson and state lawmakers, not cuts to health care. Do not balance our budget on the backs of the most vulnerable, while the wealthiest among us neglect to pay their share. Thank you all. And God bless Mr. Booker.
Thank you very much, Kim. Thank you very much. Washington takes care of its people. We cannot ignore the most vulnerable of Washingtonians. I was reminded we're mid-event. That means we have a little bit of time to go. I wanted to remind everyone, please sign on the clipboard that the volunteers have so that we can stay in touch and we can organize together. Please raise your hand if you haven't signed so we can bring it to you.
All right.
Thank you. So as my two boys, 3 and 4, they always tell me I might look like Kendrick Lamar, but I suck at singing. So I might need your help with this next chant. So this is what we're gonna say about 4 times, so that they hear that. Keep our neighbors strong and healthy. No more cuts tax the wealthy. Is that a mouthful? Okay. Keep our neighbors strong and healthy. No more cuts tax the wealthy. keep our neighbors strong and healthy. No more cuts, tax the wealthy. See that? No more cuts, tax the wealthy. Awesome. Thank you all very much. Next, I'd like to invite our friend Rachelle Martin, and I'm sorry if I butcher your name. I apologize. I will try my best. So Rachelle, the president of the Tacoma Lewis Mason Central Labor Council, and the key leader of WFSE Local 443. Thank you. Rachelle has been an essential voice to the labor movement and our fight to universal health care. Please take it away. And one more round of applause, please. Warm up.
He totally got my name right. There's a reason I put my name on the back of my coat is because it gets pretty chronically mispronounced. So I appreciate you getting it right on your first try. So yeah, my name is Rachelle Martin. I am the president of the Thurston Lewis Mason Central Labor Council. What we do is we represent every union member within those 3 counties, and we're right now with about 30,000 members. So who is a member of a union that's here, that lives in town? You should contact your local leadership and see if you can be a part of the council. So I am not just the president, and that is an unpaid position that I dedicate a lot of time to because this is so important. I am also a rank and file member of WFSE 443. Any 443 folks in the house? Anybody? Yeah, I see my buddy Isaac up there. So I work at the Department of Health and the Center of Epidemiological Practice, Equity, and Assessment. So I'm gonna talk to you about a couple different things because there is some really horrible things that are going on. So my actual job, I manage a survey called the Behavioral Risk Factor Surveillance System. It is federally funded, it goes through the CDC, and yesterday we found out that all funding has been cut from the Division of Population Surveys at the federal level. All of our project officers have been laid off. We do not know if our survey will go any further than it is right now. That means we won't be able to collect data on the people that are affected in the country. We collect information about, can you go to the doctor? Are you incurring medical debt? Do you have a job? What kind of job do you have? Are you having issues with your health because of your job? Do you wear your seatbelt? Do you eat vegetables? If you hear on the news, blah, 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 that's us. And we can't do that anymore. The federal government is silencing data collection, which means that science no longer matters in decision making. So now we're just gonna go on a feeling? No, I don't want it. So, right, we're just gonna go on vibes, right? Let's just do our thing. It'll be fine. We'll just go private sector for everything. Like that's the cure. So, things at the federal level are really chaotic. Be nice to your friends if you find out that they are federally funded, because it's a very, very, very scary time right now. So at the state level, because we get so much federal funding, we are facing major layoffs at the Department of Health. We had 200 people get laid off. They got layoff notices that they were going to be able to keep their jobs until June, and they were recently told that is no longer true. You have until April 16th, and you are no longer employed. It is absolutely shameful the way that we are being treated as disposable. We are highly trained, highly educated, and deeply passionate about the work that we do to support the residents of Washington State, and we are being gutted. So those 200 people, they all have bumping rights. So who knows who's going to have a job after this? And then we found out another 200 are going to get laid off. And so trying to find the bottom of this chaos is impossible, and it absolutely is by design by the federal government. And what we need is the state government to help us out and properly fund our programs. There is enough money to fund us, and they refuse to do the right thing. So, public health programming, it saves lives. There's just no way about it. And now we won't be able to do our jobs, and people will die, and we will not be able to keep track of the number of people that die because of these new policies. It is deeply shameful, and we need our state legislators to help us right now. What is very aggravating is at the Labor Council, we do lots of different things. One of them is political endorsements. We have politicians that come. Governor Ferguson came, hey, I'm gonna help you guys. Oh, I got your back, I'm gonna get elected. You know that I stand up for working people, and what do we see? Absolutely nothing. They do nothing. We need more revenue, We're going to get furloughed. Our jobs are getting cut. And they don't care. Because if they did, they wouldn't be doing this. And so they came and they lied to not just me, not just my group, but all of us. And said, we will stick up for you. And that is a lie. So now what are we going to do? That's right. Oh, my brother. So we're going to do a 2-second chant because I love a chant. So we're going to say, stand up, fight back. Stand up, fight back. Stand up, fight back. Stand up, fight back. You guys are awesome. So I'm not done. You're not going to get rid of me yet. So we show up for rallies because we're trying to figure out what to do. We've got to connect with each other. How can we do something? And so we stand together, physically stand together. Hey, I'm concerned about this. You're concerned about this. That's how we meet each other. That's how we do things. But then what? We can go to 1 million rallies, but if we don't make a plan to take over and get our services met, then we're just standing outside yelling, but enjoying our lovely day. So this is what we need to do. Everyone can do something. Not everybody can do everything. I know I've tried. That doesn't work out. I'm a single mom. My kid is here with me because my other kid won't babysit. So our lives are so real, and we need to lean on each other. And we do better work when we do planning. So there's a couple different things I'm going to ask you to do. If you are a union member, you need to go to your local meetings. You need to show up, and you need to say what's important. Your local is run by you. It doesn't matter what your affiliation is. So you show up and you say, this is important to me. Healthcare as a human right is important to me. The Washington Health Trust is important to me. It's important to all of us. So what are we going to do about it as a local? You make a resolution, and then you tell another local. And we talk to each other, and we pass more, and then we go to the state convention, and we say, all right, everybody listening, state labor convention, politicians show up. I have been told they will not, politicians will not listen to a policy that is affected by unions unless a resolution is passed at the state convention. So we need to figure out, how do we pass a really progressive resolution at the state level? So we got to talk to each other, right? So you go to your local. Yeah, that's my girl. But you go to the labor council because your local can do something. My friend can do something. But then you can join the labor council, and we're a bigger group. We have a louder voice. We have a little bit more pull. And there's about 10 labor councils in the state. So if you're not a member of ours, find your buddy, and then you can join them. Then you're going to join us on May 6th, where we will have a strategic planning session for healthcare as a human right, labor for single-payer healthcare, and we are going to make a plan to pass this in the next 2 years. We have to come together. We have to learn about why people are going to fight this. Because unions, we take bargaining for healthcare really seriously. Taft-Hartley is very real, and we need to know how to talk to our siblings about the benefits of single-payer healthcare, because while we all agree here, this is not a universal thing where everyone thinks this is a good idea. And a lot of union affiliates, they really pride themselves on their healthcare bargaining. But wouldn't everything be so much better if we didn't have to worry about our healthcare? If we just had our healthcare and we didn't worry about our health, we could go to the doctor when we needed to, we weren't hemorrhaging money to insurance companies, then our lives would be better, and our ability as unions to negotiate good contracts would be so much better. So, yes, right. So I'm going to give you a couple dates just to kind of keep in mind. One of the things we do as the Labor Council is we meet the first Wednesday of every month at 6 o'clock at the ILWU 47 Hall here at the Port of Olympia. That's tonight, gang. So if you are interested in keeping this conversation going, show up at 6 o'clock. I bring banh mi for everybody, and we hang out and we decide what we can do to affect change in our local community. And then you're going to go to your local meetings. If you're in a union. Not everybody is, unfortunately. If you want to start a union, you let me know. That's kind of my thing. But then I want you guys to really come together on May 6th. And you do not have to be a union member to attend. What you need is a passion for single-payer healthcare and a desire to collaborate with your brothers, sisters, and siblings to make sure that we make a plan that helps everyone, not just union members, because we are all in this together. We should not have special protections just because we were lucky enough to find a union job. Everyone deserves health care. So thank you so much.
Thank you very much, Rachelle. She's on fire.
Yes, she is.
Next, I would like, it's actually an honor to introduce Representative Natasha Hill from the 3rd Legislative. Keep it going for Natasha. So, Representative Natasha is from the 3rd Legislative District in Spokane, a strong advocate for progressive revenue. Representative Hill has been a driving force in our movement. Please take it away.
Thank you all for being here, and thank you to our organizers. I want to tell you a little bit more about myself. I want to tell you why I believe that healthcare is a human right and how we can work together to make sure that we move progress forward as soon as possible. I come from Spokane, born and raised, Eastern Washington folks. Been really impressed by how many people make their way out here to make sure that their voices are heard and they share stories with us as legislators that we can then use to push policy forward. I'm new to this. I'm a new member. This is my first year. I'm also just new to politics in general, so I haven't been bought yet. I'm also not for sale. And neither are the workers in Washington. Regardless of your status or documentation or how you got here or what you look like or what you practice or who you love. I'm also a single mom with 2 kids, so I come here making a great sacrifice to being home with them, but I've got a village standing behind me that is allowing me to show up so that I can represent for the people and for labor. I'm also the first person of color that's ever been sent from Eastern Washington to represent in the Democratic Party. And I say that as an example that we can make progress at any time. I will not be the last, that's for sure, even though I'm the first. And we've had moms in this caucus who've paved the way, including from my district, Lisa Brown being one, who had a small child on the House floor. There is so much progress that we still have to make since the time that she served. I'm here to pick up that baton and help us move it forward. One of the biggest indicators of health is where you live. And that's not okay, right? How healthy you are and the success that you get to experience in this lifetime, in this society, should not depend on where you're born. Because none of us have control over that. Poverty is one of the biggest indicators, right? So if we fix poverty and we invest in healthcare, we're going to have much healthier human beings. We're going to have safer communities. That's part of the reason that I believe that healthcare is a human right and should be a priority and a main focus for us here in Washington. We also know from this administration, because they've moved very quickly, that we are not necessarily going to be able to rely on the support we've had from our federal government. So it's up to this Washington to make sure that we're taking care of all residents that are here and any of the people that want to come here, where we are leading the way in so many things, except one really, really important one that I'm going to talk about with you all. But I want to just make sure that I fully express how important healthcare is to every resident here in Washington, from the youngest to the oldest, to make sure that if they're healthy and taken care of, that eliminates and reduces so many other burdens across all different sectors. We got to make sure that our residents here are taken care of, but we also have to take care of the folks that are taking care of us. And that's why labor is so important and our workers are so important, because if they don't show up every day, we don't have a wealthy Washington, and we sure as hell won't have a healthy Washington. So that one thing I said that we're not leading the way on here in Washington as leaders of the Northwest is our tax code. That's right. Boo on our tax code. What this budget deficit is doing is forcing us to move forward, to look at the wealth that's been created in our state. And the wealth that's been created in our state doesn't come from people who already have wealth. It comes from the people who show up every single day and work a full-time, part-time, or any kind of job across our state. If people stopped showing up, we wouldn't see wealth in Washington. And that's why we need to fix this wealth gap and make sure that we see gains across all income levels. That it's not just being stacked with the wealthy few, but that we are taxing the wealth we are all creating fairly. And we have not asked the wealthy few to pay their fair share. Instead, we've stacked regressive taxes, sales taxes, property taxes on the most vulnerable, the lowest earners, and families across our state. So I want to ask each and every one of you to help me send a really strong message over to the governor's office to let him know we need his support. His branch of government is for him to lead. But this legislative branch of government is for the House and the Senate to lead. Because we are sent here to speak for all of you, the people. This is absolutely a zero-sum game. We do not get to spend more than we earn. Doesn't it sound like a household here? You get a little bit of credit for those capital budget projects, but you got to have a plan to pay them back, and you got to have good credit for that. We do, but we only have a budget that we have to work within. Zero-sum means that if we give tax breaks to the rich, then we're taking more services away from the folks who need it. If we don't make folks pay their fair share, we don't have enough to take care of people across Washington state, to have a safety net that will catch them so that they can build back up. But if we tax wealth fairly in our state, and don't believe the hype that people are going to leave or industry is going to leave, because where are they going to go? To another state that has a state income tax, because every state in the Northwest has a state income tax, including our sister states of Idaho and Oregon. We are lagging behind, and it is past due time for us to catch up. And how we're going to catch up, right? You have hopefully seen these revenue bills that are going to tax folks making over $50 million. Companies making over $250 million. We can say to them, hey, you're an asset, but you're not better than everybody else. And you shouldn't be earning at the expense of everybody else, because you wouldn't have the wealth that you have if it wasn't for everybody else. If we don't tax wealth fairly, then to our governor's point, who are we balancing our budget on the backs of? Well, if it's not the rich, deductive reasoning tells me it's the not rich. And we need our governor to work with us, not against us. We have too much division happening nationally, and this is not Washington, D.C. This is Washington State, where we work together, we find common ground, we build bridges, and we get shit done. Thank you for having me.
That was awesome. I actually thank you for that. Thank you. Next, I'd like to welcome my great friends Jim and David Lowe to give insight. But I will introduce them through what I have in the script. But I wanted to say, organizing is an art, it's a trade, and in meetings with David and Jim and others every day, learning from them. So I just wanted to give that accolade to them before I read. David from the Puget Sound Advocates for Retirement Action, and Jim Howe, an American Federation of Teachers Retirees Chapter Director. Both David and Jim are HICR, Healthcare is a Human Rights Committee members, and will speak on leveling the Medicare playing field. This is a crucial issue for our state's budget and protection against Medicare privatization. David, please share with us your insights, and Jim. Sorry.
Thank you, Shidane. And Rachelle Martin talked about a very important session that we're having on May 6th to talk about getting to universal health care and single-payer health care in the country, but most importantly in Washington State. If you sign in on the sign-in sheets that are going around, you will be sure to get the information about that. So please be sure, if you haven't already, to sign in. Okay, so it's no news that our precious Medicare program is facing the threat of being completely privatized for the benefit of the for-profit Medicare Advantage plans. The good news is that a pushback campaign was launched by the Washington State Labor Council in 2023 that is now gaining national traction, even as the Trump regime increases the threats to Medicare. The strategy is level the playing field between traditional Medicare and the private plans. What does this mean? It means adding to traditional Medicare the vision, dental, and hearing benefits and much lower out-of-pocket cost, which the private plans offer because they are so heavily overpaid from the Medicare Trust Fund. Leveling the playing field would offer all Medicare beneficiaries a real choice. At present, most lower-income beneficiaries choose the private plans because they are less expensive at first. The real problems can occur when people with serious or complex illness cannot get the care they need because of private plans' narrow provider networks, prior authorizations, and delays and denials of care.
In 2022, our state's healthcare authority attempted to save money by eliminating the traditional Medicare option for public service retirees and forcing them all into a private Medicare Advantage plans. Hundreds of retirees pushed back. I see some of them right here, and the plan was shelved. We all showed up at a board meeting and changed. We formed a Medicare stakeholders coalition of 8 labor and retiree organizations, and I'll name them. The Retired Public Employees Council, the Washington Education Association Retired, AFT retirees, okay, AFT's in the house, Washington State Alliance for Retired Americans, PSARA, Puget Sound Advocates for Retirement Action, the Washington Federation of State Employees, the Social Security Works, and the Senior Lobby. We have worked with the Healthcare Authority to improve how it engages with retirees. One result was to redesign the prescription drug plan for retirees in traditional Medicare, lowering their premiums. Okay, how does the national fight to level the Medicare playing field relate to our fight around the state budget? Like the nurses said, I was retired from the state college after 25 years, and we've been through this rodeo before, okay? It's up to, and it always ends up costing more when they cut back like this. So improving traditional Medicare benefits would save our state budget a lot because the state would no longer have to pay for the expensive vision, dental, and hearing benefits for public service retirees in traditional Medicare.
But we cannot win this national fight in time to help our state budget this year. In the longer term, these battles are very much connected. We must persist in the campaigns to lower our state's healthcare costs. So let's push forward to level the Medicare playing field, and let's help our state lead the way to a national plan like Medicare for All by building a state healthcare plan for all Washingtonians, which will save billions of dollars of healthcare spending in this state. So be sure to sign on somewhere on a clipboard.
Thank you very much. Please keep it going for David and Jim. Okay, so next, Caroline Brotherton from the Economic Opportunity Institute and the Balance Our Tax Code Coalition. Caroline, yes, has actually recently had a very inspiring revenue rally. We would like to please share with us we'd love to have you here. Come join me on stage. I'm out of words.
Thank you so much. Wow, this is such an inspiring group of speakers, and I love how so many speakers have been pointing to concrete actions that we can take today, in a month, this year. So thank you so much to everyone who's spoken. I really appreciate it. My name is Carolyn Brotherton. I'm here on behalf of Balance Our Tax Code, which is a coalition of about 100 organizations all across the state, laser focused on reforming our tax code. We've heard about it multiple times today. Balance Our Tax Code. Basically, the goal of Balance Our Tax Code is to transform our tax code from one that is deeply dysfunctional and regressive to one that is sustainable and progressive, which is a great goal. I'm also here representing the Economic Opportunity Institute. We are a policy institute based in Seattle that's been fighting for about 25 years to make Washington a better place. So yeah, thank you so much. So I have a question for you. This is the interactive portion of my remarks. Is the role of our lawmakers to maximize the profits of corporations and their shareholders? Okay, I was thinking I could just stop talking then, but I have a few more things I will say. So there's a phrase that I really like that I think AOC coined, which is that every billionaire is a policy failure. And the reason she said that, I think, is that there's something deeply wrong about our society when we have hundreds of people just in Washington state who have more wealth than the kings of history. And at the same time, we have millions of people every day wondering how they're going to pay their basic bills. It's wrong. That's wrong. There's something deeply wrong when we are one of the most wealthy states in the wealthiest country in the history of the world, and yet in a non-recession year, this year, our lawmakers are proposing to make cuts to healthcare, childcare, community colleges, public workers, and so much more. That's just wrong. So the extreme wealth inequality in our society and the downstream effects of it, which we've heard a lot about today, they are undemocratic, unhealthy, and unseemly. And simply put, it really gives me a tummy ache. So in front of our lawmakers right now are several proposals to actually make our tax code more fair and prevent the cuts to basic services that mean life and death for some of our neighbors and friends, and some people actually gathered here today. In this era of extreme wealth and wealth inequality, it is simply common sense for lawmakers to ask the wealthiest among us to pay a bit more. So right now, there are things that we can do this session, and actually there's a hearing tomorrow morning at 8 a.m. in the House Finance Committee that you can sign in today to take action, and you can testify, and you can show up tomorrow morning in House Finance. One of the bills that's being heard is a financial intangibles assets tax, which is also known as the wealth tax. Give it up for the wealth tax. So this is something they could pass this session. The wealth tax is a modest tax on extreme wealth held in Wall Street stocks and bonds. It's been studied by the Department of Revenue, and they deemed that it can be done, that it's legal. And not only that, similar taxes are popular and successful parts of the tax systems in countries like Switzerland and Spain. So it's been done, it's legal, it's doable, and not only that, I've heard it's very, very popular. So you can sign in tomorrow, House Finance, 8 a.m. Keep that in mind. Come talk to me afterwards if you need help doing that. Other proposals, some of which are being heard tomorrow and have been heard earlier this week, are taxes to make business tax more progressive. We already heard from Rep. Hill about that one, as well as asking companies that employ very high earners to pay more in taxes. These are popular and progressive approaches to fix our tax code and also prevent cuts that we do not need to make. So the last thing I really want to say is, $1 billion is a really, really big number. Yes. It's a number that is hard to understand. Multimillionaires and billionaires who will pay into these taxes will not have their quality of life impacted. In fact, they should, but these taxes are very modest. In fact, if you were listening in on the hearing on Monday in the Senate Committee, Ways and Means, they heard the wealth tax, and actually a few people who would pay the tax testified on Monday that they practically begged lawmakers, please, please do this. Please do the right thing. Because I have so much money, I don't know what to do with it. I've bought all the art, I've bought the yacht, I've bought the houses, and I still have so much wealth. And I really just look around and I see so many people struggling and I want their life to be better. Please tax wealth. These are the people who would pay it. So it's not just popular with us, it's popular with the billionaires because they know that life will be better when we have a more reasonable tax code. So, these proposals are not radical. What's radical is extreme wealth. What's radical is the fact that we are a wealthy state and people are dying because they can't get health care. What's radical is the kids that we heard about earlier who aren't getting the care they need. These are the radical things. Extreme wealth is radical. Taxing wealth is actually really reasonable. So these are critical band-aids. This is not a blood transfusion. This is not surgery. These are small band-aids on a system that is at a crossroads of change. Lawmakers have the chance to pass these policies this session, so let's make sure they hear that from us. Thank you.
Thank you very much. Please keep going for Caroline. Thank you, everyone. One more chant, and then we actually have an open mic, very exciting open mic. In a little bit, but I want to leave you all with this, and I'm gonna try to be as artistic as I can, so please bear with me. 1, 2, 3, 4. Healthcare is what we're fighting for. 5, 6, 7, 8. It's a crisis. We can't wait. Okay. 1, 2, 3, 4. Healthcare is what we're fighting for. 5, 6, 7, 8. It's a crisis. We can't wait. 1, 2, 3, 4. Healthcare is what we're fighting for. 5, 6, 7, 8. It's a crisis. We can't wait. One more time. 2, 3, 4. Healthcare is what we're fighting for. 5, 6, 7, 8. It's a crisis. We can't wait. Thank you very much. I'm gonna give the mic to my great friend Nathan to lead the open mic session.
All right. No, this is a poetic thing, everybody coming out. Thank you so much, everybody, for coming out. We're going to do open mic now. I want to check. We did have one person that was lined up. I don't know if they're here. If you know that we talked to you about being first. No? Okay. Sorry, I lost the name on my sheet here.